Hey, what's up, everybody? Dr. Taylor, Aspire Chiropractic. Today I want to talk to you about something that comes into our office pretty commonly. And you know what you got going on, but you're not saying it right. It's basically it's a diagnosis from a friend of a friend, or a diagnosis from Dr. Google, which as a healthcare practitioner is my favorite. So come in here, Doc. I got this thing going on. We've got our spine here, got our shoulder blade right here, arm bone, skull. Feels like I'm being stabbed right there. Okay. And you come in and you say, my previous chiropractor, and I do this myself because sometimes we just explain things in a way that's easier to understand than what's actually technically right. Come in, my old chiropractor said I have a rib out. Now, it's a way to understand exactly what's happening and what's going on, but it's wrong. So let's figure out what's right. So if we've got our skull right here, and we've got our spine here, our shoulder blade, our humerus or the upper arm, and then we've got our ribs. Now our ribs come straight out of our spine, and as they curl around the front, they go forward and down like that. So you come in, hey, I've got a stabbing pain, a burning pain right here. So typically what's going on is we'll have a subluxation in the spine, okay? One of the bones in the thoracic area of the spine is subluxated. It's lost juxtaposition to the bone above or the bone below. What that's going to do is going to cause a muscle spasm of something called your rhomboids, okay? Now your rhomboids are muscles that go from your shoulder blade to your spine, and they work on retraction. It's going to cause reflexive strain of another muscle called your levator, which goes from the top corner of your shoulder blade up to the base of your skull, right up through there. And now these muscles are deep to another gigantic big muscle called your trap. Okay, we'll just draw this one on the other side. Just like that. So between your rhomboids, this one here, your levator right there, and then the big muscle that lays on top of the whole thing, your trap, if we get a bone out of place here, because all those muscles connect to your spine, if we get this guy right here, all of a sudden he's tilted and crooked, which again, technically isn't right, but it's a way to get the idea across. That causes that reflexive muscle spasm. It can cause knots right here. That's going to give you that stabby feeling, causing all those issues there. Now, what perpetuates this kind of thing? Your job. So often people are forward. They're driving, they're at a computer, they're on their phone. It's this closed posture, this closed procedure here. And when you do that, shoulder blades go forward. Those muscles here get stretched out, okay? And then what happens? That's going to cause that subluxation there, and it's just this whole cycle over and over and over again. So what do we do to fix it? Once we figure out what's going on, in all reality, you say that one sentence, Doc, it feels like I'm getting stabbed right there. I'm like, okay, well, there's a 99% chance I know what's happening already without even having to touch you, without even having to x-ray you. Now, here at Aspire Chiropractic, we're still going to do a full exam because there could be other stuff that's compensating for this or because of this. We're still going to take an x-ray because I move a bone. I want to see exactly what's going on in there. But again, you say those words, I got the stabby feeling just off to the side of my spine. I know what it is, but I also want to make sure there's nothing else going along with it. So we adjust the spine, get that segment moving again. We work on the muscles and soft tissue here, get those to release, and then I give you advice, and ideally you follow it. So when you are at work, I tell you to get out of this kind of position because that is what stretches all those muscles out there, which brings those shoulders forward, which makes you unhappy. But you come in here, I adjust you, I give you some good quality advice, you leave here feeling better. And then you're happy. So again, Doc, I got this stabbing thing right by my shoulder blade. Cool. Odds are you probably have a rib out. You don't. but hey, we all know what we're talking about. At least we're all on the same page. So if you know anyone out there that's got a stabby feeling, it's a feeling, it's not actually being stabbed. If you're stabbed, don't come here. We don't do that. Go to the ER. But you got someone with a stabby feeling, causing neck pain, back pain, headaches, something kind of like that, and you're tired of hearing them complain, tell them to give our office a call, or hell, just bring them with you. Walk right through the door. We're ready to help you right here at Aspire Chiropractic when you're ready to be your best. Naturally.